Good afternoon, everyone. Thanks for joining us for this update on the COVID-19 situation in Texas and what the latest science and data tell us about the virus, particularly what we're learning about the protection the vaccines provide, the few breakthrough cases we have seen across the state and what's behind those, as well as how they show the benefits of vaccination, and why getting vaccinated now, really as soon as possible, is more important than ever based on what we are seeing with COVID-19 in Texas right now. I'm Chris Van Dusen with the Texas Department of State Health Services, joined today by Dr. Jennifer Shuford, our Chief State Epidemiologist, who you'll hear from in a moment, and Dr. Saroj Rai, the SHS Senior Scientific Advisor. She's on hand, as is so often the case, to lend her technical expertise on vaccines. This briefing is being recorded, and we'll send out a link once it is posted. Just wanted to start out by outlining the current situation with a few slides. Many of you have followed these numbers every day, so the idea will be familiar. First, new confirmed cases reported each day over the past year. You should see that in a moment here, popping up for you. We always recommend, of course, looking at not a single data point, but watching those averages and the trends over time to get the best indication of what is happening. You can see the blue line there. The dots are the actual data points. The blue line is the 7-day average. So going back a year, you can see the tail end of that first wave last summer, then the winter wave that we saw, and we have seen, as you see there, a significant increase in cases starting about a month ago in early July. And it has been a very rapid increase in line with what we've seen with the previous wave, and Dr. Shuford will talk a little bit about that in a moment. Just as telling and concerning are hospitalizations. One of the really most consistent and most reliable indicators we have as far as the reporting goes, and we have seen the same kind of rapid increase over the last few weeks with the overwhelming impact on people who are not fully vaccinated. And we now started to see an increase in reported fatalities as well. This shows deaths by when they were reported rather than when they occurred, but you can see those starting to creep up as well. This is typically the most lagging of the indicators, sort of our main data points that we look at, but it is somewhat inevitable, really, that a couple of weeks after hospitalizations rise or fall, we see those fatalities start to rise or fall as well. And when you look at week-to-week trends, the 7-day average of new cases is up 92% from last week. Hospitalizations are up 49%. Fatalities are up 15%. So those are all going in the wrong direction, I'm afraid to say. Fortunately, the best way we have to turn those trends around is, of course, for people to get vaccinated, and there is some good news on that front. The pace of vaccination has picked up over the last month. You can see a graph here of the average number of COVID-19 vaccine doses administered over the previous 7 days from these points. So we hit a low there after July 4th, about 44,000 daily doses, and that's gone up pretty steadily since to more than 75,000 as of yesterday. It really seems that people are getting the message that this is a serious situation. If they have been putting off getting vaccinated, now's the time to stop. Don't put it off any longer. This is the time to get vaccinated if you've been waiting, if you thought you were not at a great risk of this, because we are seeing hospitalization rise really across all age groups at this point in Texas. And the good news is, again, if you are not vaccinated yet, there is something you can do to protect yourself and protect the people close to you. The vaccine is free. You don't need an ID. There are vaccine providers across the state who are available today. You can walk in and get a vaccine at many, many locations without a wait in just a few minutes. If you need more help, more information on the vaccines, on where to find them, you can go to covidvaccine.texas.gov. So that's the sort of the quick backdrop of where we are right now, why we're so concerned, and what people can do right now to help. With that, I'll turn it over to Dr. Shuford to dig in a little bit more on the science and tell us more about what we're seeing, particularly with the variants in Texas, that Delta variant specifically, as well as breakthrough cases. Dr. Shuford.
Hi, y'all. So Texas is experiencing a sharp rise in cases and hospitalizations, and this has been driven by the Delta variant. CDC estimates that more than 80% of COVID-19 cases nationwide now are due to Delta. And our preliminary data suggests that over 75% of COVID-19 cases in Texas are now due to the Delta variant. And what Texas is experiencing is similar to what's happening across the United States and around the world, or has already happened in some places like the United Kingdom. So let me show you what's happening with our cases right now. And what this graph shows is the increases in cases, and I'll show you hospitalizations, that we saw with each of Texas's 3 pandemic waves. Each of these three lines starts at the low point right before Wave 1, Wave 2, and Wave 3 hit Texas. And so the red line shows the first wave of the pandemic in June and July of last year. The yellow line shows the second wave of the pandemic from October of last year till January of this year. And then the blue line shows this current third pandemic wave, which started at about the beginning of July. And what you can see is the rise in cases is similar to what we've seen in previous waves and might even be steeper. And that really shows how contagious the Delta variant is. It's spreading much more rapidly among unvaccinated people than the viruses that we saw last year. You can go to the next slide. And this shows hospitalizations. And what you can see is exactly the same thing that showed with the cases, is that that blue line, the third wave, we're seeing steep increases in hospitalizations, steeper than we saw at the same point of even the first wave or the second wave. And this alarming rise in cases and hospitalizations makes it even more important for every person to go get fully vaccinated. We know that these vaccines work, even against variants like Delta. We know that no vaccine is perfect. They never will be. And so there will be some breakthrough cases. And this is especially true for people who might not have a strong immune response to the vaccine in the first place, people like immunocompromised people. But most vaccinated people are protected from getting sick with COVID-19, including this Delta variant. And those vaccinated people who do get sick with COVID-19 are likely to have a shorter, milder illness. And fully vaccinated people are very well protected from severe illness and death from COVID-19, even when we're talking about the Delta variant. Since vaccinations began, nearly all COVID-19 deaths in Texas are in people who have not been fully vaccinated. But one thing that has been apparent from research on Delta is that it's very important to get fully vaccinated. That second dose of a two-dose series is really important to the vaccine effectiveness. This is one way that Delta is a little different from some other variants. One dose of the two-dose series appears to provide better protection against earlier strains, but protection against the Delta variant really requires a person getting fully vaccinated to get both doses of those Pfizer and Moderna vaccine series. So I would encourage any eligible person who is not vaccinated to get vaccinated as soon as possible. And if you've received one dose of Pfizer or Moderna and are due or overdue for that second dose, I'd encourage you to go get it as soon as possible. In the meantime, our public health guidance is that anyone who is not fully vaccinated should wear a mask and physically distance when they're in indoor public settings. And this includes kids age 2 and older who aren't eligible for a COVID-19 vaccine yet. Recent outbreaks, like the one that just occurred in Massachusetts, have shown us that some people who are fully vaccinated can get infected and might be able to spread it to other people. And because of this, CDC recently changed their guidance about fully vaccinated people. They now recommend that fully vaccinated people who are in areas of substantial or high community transmission wear a mask in indoor settings, indoor public settings. And for anyone who's interested, CDC's COVID data tracker can help you determine the level of transmission in different counties across the whole United States. But regardless of geographic location or vaccination status, other people might also want to wear a mask when they're out in when they're in a public place, or if they or a family member have a weakened immune system, or if a family member is unvaccinated. We know that masks are effective. Masks can protect the person wearing the mask from getting COVID-19, and masks can prevent the spread of COVID-19 if the person wearing the mask is infected and doesn't know it yet. And this is true even for the variants. And even though this huge surge in COVID-19 cases and hospitalizations is similar to what we've seen previously, this third wave is very different in one way. This is the first time that we have had widely available, highly effective vaccines that can prevent the spread of COVID-19 and can prevent the terrible impact that COVID-19 can have on Texans and their families. We know that some people have questions about the safety and effectiveness of these COVID-19 vaccines, and that is totally understandable. It's good to have questions. The time is of the essence right now. COVID-19 is spreading quickly in Texas and causing increased hospitalizations in every age group. Some of these people are dying, and many who survive are experiencing those longer-term complications from COVID. So for those people with questions, don't wait to ask those questions. Talk to your healthcare provider as soon as possible about those questions and concerns. Your healthcare provider can answer those questions and help you with the decisions you're trying to make about COVID-19 vaccines.
Thanks, Dr. Schuford. With that, we'll take your questions. As a reminder, it's been a little while since we've done this, so if you type your questions into the question box, you should see that on the right hand, at least it should start out on the right-hand side of your screen, and include your outlet, if you would, so we can recognize you in that way. And we'll take as many questions as we can. We've had a few emailed questions in ahead of time, and some folks already putting in questions. And a few of them kind of share some similar themes, particularly around the variant cases. So, Dr. Schubert, let me start with this from Steve Fountain. Am I correct that the PCR test cannot identify the variants? If so, how are people tested for Delta? What percentage of new cases are lab-confirmed Delta cases, and how do those numbers compare between fully vaccinated and not fully vaccinated people, to the extent that we know that?
So you're right. A normal PCR test does not identify a variant, meaning that it can't differentiate between different variants. The lab tests that we use to diagnose COVID-19 work against all the variants. They just can't differentiate between them. And so anybody who is identified as having a variant, that lab test from the PCR test is actually then sent to another lab where they do genomic sequencing. And so by looking at the genetic sequence of that virus, the lab workers can tell which variant is and identify that variant. And so that information we can get back from a variety of sources. Laboratories here in Texas can send it directly to us, but we also get some of that information back from CDC, from labs that they've contracted with to identify different variants here in Texas. And so because the variant genomic sequencing that we do is on a limited sample of cases, and they're not always tied to a particular lab test, a PCR test. We can't always tell who's been vaccinated or partially vaccinated or unvaccinated from those results that we get, but that we are looking at that broadly across Texas just to see from the data that we do have, like how many are vaccinated versus not fully vaccinated. We're doing those analyses right now, looking at cases as well as mortality, deaths, to see if we can associate vaccinations and that mortality and case data.
And that's an important thing to do from a public health standpoint, so that we sort of have visibility on the variants and what's circulating in Texas. Do want to point out, though, that sort of from a treatment standpoint, the treatment for the individual is going to be the same. Am I right in thinking that, regardless of sort of what the variant is?
Right. And so there are some therapeutics or treatments that are available for COVID-19 cases, and the ones that are available treat all of the variants that are circulating widely right now. And there have been some changes in which therapeutics are available based on which variants are circulating. So it is a work in progress and something that researchers are working hard to keep up with, to make sure that the treatments that we're offering can treat all of the different variants that are circulating in our communities. We know that there's a lag time between somebody getting diagnosed and that genomic sequencing actually happening. So that can't help us on the front end with treatment decisions, but it does help us on the back end know what's going on across Texas and how we need to adjust our guidance or some of these therapeutic options.
Question from Haley Hernandez at KPRC in Houston, sort of along those same lines. How are you able to identify that someone who is considered a breakthrough infection is in fact vaccinated? Is it an honor system where you rely on someone's word? If so, how do you, are you sure that you're contacting everyone who gets positive? And maybe just talk to us a little bit about collecting the data on those breakthrough infections.
So we have different ways of getting information about breakthrough cases. What we're asking our local public health departments to do, though, is report to us cases in their jurisdictions where they've had somebody who is either hospitalized or has died of COVID-19 that was vaccinated. And so we are actively looking for vaccine breakthrough cases that are clinically severe enough that it requires somebody to go into a hospital or cause a death in somebody. We know that there's going to be a certain number of people that have mild breakthrough cases, but so what we're really focusing on is finding those people that have those clinically severe cases that do represent breakthrough cases. And so we're getting these reported to us from local health departments across the state, and they're doing a fantastic job. It's hard work. We're also going to do some further analyses of data that we have at DSHS, just to make sure that we're really capturing all of those severe cases and deaths that are partially or fully vaccinated, so we can make sure that we are fully understanding the data with the new variants that are coming and all of the new case reports and hospitalizations and deaths that we're seeing across Texas.
A question from Maggie Glenn at KXAN. Those in the medical community who have been following the changes in the pandemic understand that recommendations and treatment options change because that's the nature of medicine and science. How can you explain to those who view the variability in recommendations as a reason to not trust what our health experts are telling us to do and convince them that the advice to get the vaccine won't change and is safe?
I think one of the things that we're trying to do is just be as transparent as we can. We know that this is a brand new virus, and it is changing as we go through this pandemic. And so here at DSHS, and I think public health workers across the country are trying to make sure that they say, you know, this data is evolving rapidly. We'll give you the best advice that we can, but any advice that I give or guidance that I give is true as of this minute on this day, and it is likely to change in the coming days to weeks to months. And so just trying to be transparent that this is an evolving situation, and that our guidance will change because we are trying our hardest to base it on science and facts and make sure that we are using the most recent, strongest data that we can to make recommendations for the people of Texas.
A couple of questions from CBS 11 News. What should school districts do to make sure kids are safe in schools? What guidance are we providing TEA on that? I know TEA is working to update their guidance to schools, and we've been in contact with them about that. But Dr. Schubert, just sort of general guidance about staying safe in schools and those kinds of settings?
So you're absolutely right. CDC has guidance about operating schools safely, and TEA is coming out with guidance, and so it's going to be fantastic to have those guidance documents. In general, we do recommend, though, that anyone who's not fully vaccinated wear a mask when they are in a public setting, so with people outside of their household. And in addition to wearing a mask, do physical distancing. And that's true for any member, any Texan who's not fully vaccinated, kind of needs to follow those same prevention steps so that we can help slow down the spread of COVID-19, and especially now that we're dealing with Delta.
Question on the vaccine side. Dr. I'll bring you in on this one. Jessica Shorten asks, is there a high percentage of people who have received only one dose of the 2-dose shots, and why are people not getting a second dose?
Good afternoon, Chris. Thank you so much. So the question about are there a high percentage of people who are not vaccinated with second dose? The recent data poll we have done for our state of Texas, we have around 9.5% of individuals who have received the first doses, but have not yet received the fourth. They're actually overdue for their second doses. So we are really encouraging every individual to go and please get your second dose as soon as possible, even if it has been in the previously recommended guideline of 42 days. Please go ahead and get your second dose. From many vaccines are available throughout the state. So there was a second part to the question, Chris.
Well, it's just the reasons for that, if we know.
I think those reasons are pretty various. Individuals, thought that perhaps with the first dose we had some protection, but we know, as Dr. Schubert has just stated, that really important with the Delta variant to get your second dose. So we are continuing to urge, and our providers are doing a tremendous job. So if you have any questions, please reach out to your healthcare provider, your pharmacist. Reach out to us if you have any questions, but we urge and request you to complete the vaccination series.
Thank you very much. Dr. Shuval, ping back to you on this one. A couple of questions sort of about differences in what we're seeing with Delta. Ali Morris with the Dallas Morning News asks, can you talk about how this surge is different from past surges we have seen? Are younger people being hospitalized? What percentage of people hospitalized or who have died is vaccinated? And then let me fold in a question also from Ashley Lopez with KUT. Local doctors in the Central Texas area recently started raising concerns about an uptick of pregnant women being hospitalized with COVID-19. And are we seeing that statewide too?
So we are seeing COVID-19 spread quickly across Texas, and because we know that this is hitting unvaccinated populations, it's really surprising the rapidity, the rise, the steep rise of cases that we're seeing in the face of 42 to 43% of our population being fully vaccinated. And so we are concerned that this is rapidly spreading through unvaccinated communities. And, you know, when we look at vaccine coverage, we see that those older age groups do have a higher vaccine coverage than the younger age groups do. So we do expect that more of these cases are going to be seen in younger individuals just because they don't have that protection from being fully vaccinated. And that some of those people are going to be in the hospital. As I've mentioned, we're seeing increased hospitalizations in every age group, including our pediatric age groups. So we're going to continue to watch that really closely. You know, here in Texas and in the United States, it's hard for us to tie our public health data to our hospitalization data because those data sets are separate. And so that's why it's useful in some places like the United Kingdom where those are tied together that we can get some good information about who's ending up in the hospital and the vaccine effectiveness against hospitalization. And so like I said, that Pfizer vaccine in the United Kingdom has been really effective at preventing hospitalizations. They showed a 96% vaccine effectiveness for that Pfizer vaccine after 2 doses to prevent hospitalization. And so we know that our vaccines can really protect against hospitalization even with the Delta variant. Just looking at fatalities, we can see that our data show that less than 2% of deaths from COVID-19 in Texas are in fully vaccinated people. And when we look at that small group of people who have died of COVID-19 after being fully vaccinated, about 95% of them are 60 and older, and over 70% of them have an underlying condition. So they've got other risk factors where maybe their immune response wasn't quite as great to that vaccine, and they're just at higher risk of disease progression because of those underlying factors. And so we do believe that being fully vaccinated really can protect people from hospitalization and death due to COVID-19, including those cases caused by Delta.
Next question from Kier McCarthy at the Fort Worth Star-Telegram. Does DSHS have any plans to financially or infrastructurally support outreach efforts like door knocking or information distribution in local communities? And that's a little bit out of you guys' wheelhouse, but I'll actually talk a little bit about that. We do, in fact, we are kind of recruiting folks now, local organizations, nonprofit groups, churches, local government groups, health allied groups, and others. To apply for part of $10 million that we've set aside in federal funds to support these local groups and really these local efforts to reach out to people, educate them about vaccination, help them get to vaccination sites, whatever that looks like for those communities, for those groups. It's a partnership we're having with Texas A&M Health to administer that grant. So those organizations can go to health.tamu.edu/vaccinegrant.html to find out more about that and how they can apply for some of those grants. Those grants can range from $50,000 to $150,000 for those local groups. And really the effort is to get that money on the streets to really help the folks who are engaged in communities and a part of the communities around the state that, still have people who need to be vaccinated, help them increase that education, increase that access to vaccines in whatever way is going to work within their communities. If you didn't get that web address, you can go to our news releases page. It's the most recent news release that we have there, and you can find out more information about that. So thank you. Let me scroll down a little bit here. Find the next unasked, unanswered question. We got Allie. Let me see here. Travis Bubenik with Marfa Public Radio asked, does DSHS have any plans to bring back mobile testing to rural parts of Texas, specifically in the Big Bend region where widespread testing has been basically non-existent for months now? I think there are places, testing is available in communities, but we certainly continue to work with, our partners in state government at TDEM and elsewhere to make testing available as widely as we can, and because that's still an important part of this pandemic response. We want to be able to identify people so that they are aware of their status and they know when they need to, stay away from others and stay home. So that certainly is part of the ongoing response. Another question from Kira McCarthy at the Star-Telegram. The race ethnicity of almost 8% of people vaccinated is unknown, as DSHS always required vaccine providers to record a person's race and ethnicity. If not, when was that made mandatory? Dr. Wright, can you speak to that?
Hi, Chris. Yes, thank you for the question. Actually, the exact date when we made that mandatory was February 4th, so earlier in this year. And we have seen significantly, week by week after week, that number really improve. And the 8% that's, designated as others, we're actually looking into that even further to see what all constitutes in that.
I believe, people can decline to specify their race or their ethnicity, and so that would be one reason that may be unknown. David Littman in Tyler asks, is the percentage of breakthrough cases changing during this new wave? That is, are vaccinated people higher or lower percentage of people testing positive or getting hospitalized sort of as we go through time?
Yeah, so that is a fantastic question and something that is a topic of active research. We know that with the variants that, like I mentioned, being fully vaccinated is really important to provide that level of protection, but that with the variants that vaccine effectiveness is impacted with some of these variants, and so we are going to watch that really closely over time. We're doing those analyses right now to see if what we saw over the entirety since we've had vaccines, say, December through now, looks different than it has just in the last 2 months, and we're actively acquiring that data and doing those analyses.
And we're running up against time here, but we can hold over a little bit just so we can get to a couple more questions here. Brooke Ontiveros asks, if it is necessary to get 2 vaccine shots to be best protected, does that affect those who receive the single-dose Johnson & Johnson vaccine?
No, being fully vaccinated just means getting the vaccines that were in that particular manufacturer's series. And so for the Johnson & Johnson, that's just 1 dose. So 2 weeks after that 1 dose, you're fully vaccinated. And for people who got the Moderna or Pfizer, that means getting both doses at the recommended interval. And then 2 weeks after that 2nd dose is when you become fully vaccinated.
And Meredith Yeomans at KXAS in Dallas says appointments for COVID testing are picking back up, as we would expect with more people being exposed. Can you comment on the amount of tests available? Is there a concern about having enough tests available, similar to what we saw at the beginning of the pandemic? I have not heard any of those kinds of concerns.
I have not heard any concerns either. We actually have a lot of testing supplies right now, which is different than at an earlier point in the pandemic.
And one final question before we have to go. Allie Morris has a follow-up. She asks, in the increase in pediatric hospitalizations, can Dr. Schubert address that more? What type of increase among what age groups?
Yeah.
To the extent that we know.
I know, it's difficult because our hospitalization data comes in certain chunks of the population. And so the age group that we get aggregated is 0 to 17. And that's just part of the federal guidance for reporting hospitalizations to public health. And so I can tell you about that 0 to 17-year-old admissions is going up. We're seeing increases in new hospital admissions in that age group, just like we're seeing in every other age group. But it's a little hard to parse it out beyond that pediatric age range.
And finally, let's wrap it up with this. Jessica Shorten with the Montgomery County Gazette asks, or notes that there have been reports that symptoms for the Delta variant are different than traditional COVID, maybe more flu-like symptoms appearing first, aside from coughing or loss of taste and smell. Is that true? Have you heard that? And if so, does that affect when someone should go and get a COVID test?
So the symptoms are going to look very similar to every other strain of COVID-19 out there. We don't expect that there's going to be unique characteristics or symptoms about this particular strain that will make you go get a test before it would have on any other strain. And so, you know, any different study shows a slight different combination of symptoms being predominant, but the same symptoms that are listed on our website are true for Delta variant, just like they are for any of the previous variants of COVID-19.
Thank you very much. Thanks to Dr. Schufer. Thanks to Dr. Ryan. That's all the time we have today. Thanks once again for all of you for being with us. We'll send a link to the recording this afternoon. That's usually available within an hour or so of the end of the briefing. And thanks so much for sharing this very, very important information with your readers, your listeners, your viewers. It is critical that people continue to get vaccinated because that is really the way that we are going to turn the tide on this. Where there's so much disease spreading across Texas, looking at the COVID-19 virus. So thank you once again for sharing that information with everyone out there. If any additional questions come up, of course, you can reach us at pressofficer@dshs.texas.gov. Thank you very much and have a good afternoon.